Hi, my name is Emma. I'm a research coordinator at Mount Sinai at the Mood and Personality Disorder Research Lab. I'll be presenting today along with Kimia, who is a graduate student, and Deborah and Ravana, who are volunteers at Mount Sinai. And we will be presenting on the impact of the pandemic on access to essential needs and psychological well-being.
Hi, my name is Deborah Lee. Recently, more attention has been drawn to the psychosocial impacts of COVID-19. Among these impacts are persistent isolation, financial burden, and many more. We aim here to better study these salient stressors and identify particularly vulnerable groups. These groups include individuals with pre-existing psychiatric illnesses, as well as those of lower socioeconomic status. In this study, we use the NIH's Coronavirus Health Impact Survey, also known as CRISIS. This survey collects information about demographics, risk level, and changes in daily life before and after the onset of the pandemic. We use CRISIS here as a powerful tool to gain a snapshot into the effects of COVID-19 on the general public.
In this study, we had 37 participants with various psychiatric disorders, including mood and personality disorders, as well as other trauma-related disorders. The healthy participants were from our Mood and Personality Disorders Research Lab here at the Icahn School of Medicine at Mount Sinai. In this study, we used the NIH's Coronavirus Health Impacts Survey, which is also known as the CRISIS survey, that was administered remotely through the Red Cat platform. Our participants were asked to answer questions divided in two groups. The first questions were related to their self-perceived well-being 3 months prior to the pandemic, and then they were asked to answer questions about the lowest points 2-week period during the pandemic. Participants were then divided into two groups of low and high socioeconomic groups, and the descriptive analyses were then performed to examine the differences between both of the groups through SPSS.
As mentioned before, our study looked at the crisis survey response on a sample of 37 participants from New York City. The results showed significant differences in psychosocial experiences between those of high and low socioeconomic status. Of note was that 55.6% of essential workers in our sample were of low SES status. Groups of low SES status reported significantly lower feelings of positive change during the pandemic compared to those of high SES status. Additionally, our participants reported increased feelings of worry, sadness, loneliness, and negative thoughts, as well as a decrease in therapy frequency, which may have in turn exacerbated the negative psychosocial effects of the pandemic on these populations. Going forward, it will be important to identify more vulnerable groups and the specific impacts of COVID-19 on these populations to help prevent long-lasting damage and negative psychosocial effects, especially among those who seem to be unequally impacted by the crisis, namely those of lower SES status and essential worker status. It is also important to provide proper resources and medical care to those experiencing various symptoms of anxiety, loneliness, and depressive feelings in order to prevent long-lasting damage and negative effects. Additionally, researchers should be working to identify more susceptible groups and put in place protective measures that could help prevent negative psychosocial effects in future crises. These vulnerable groups, as of now, seem to be mainly including those with prior psychiatric comorbidities, those who are of lower socioeconomic status and have lower access to frequent therapy, as well as those who have been shown to be considerably affected by the implemented lockdown measures, namely adolescents, children, and teenagers. Thank you.
So we found that about 60% of our sample reported experiencing moderate to extreme financial difficulty. And in addition, about 41% of the sample reported yes, that they were experiencing worry about access to food. And this is shown in the pie charts in figure 1A and 1B. Now going to figure 2, we also looked at essential worker status and compared this between the low socioeconomic status and the high socioeconomic status groups. And we did find that about 56% of the low socioeconomic status group reported yes, that they were essential workers, whereas only 23% of the high socioeconomic status group reported being essential workers. So we found a trend level significance of the low socioeconomic status group being more likely to be essential workers in our sample. And then moving on to figure 3, we also looked at self-reported experience of positive change during the pandemic, if there was any at all, or if there was no positive change. And we did find that about 85% of the high socioeconomic status group reported that, yes, they did experience some positive change due to the pandemic, which was significantly greater than the low socioeconomic status group, where only 39% of that group reported experiencing a positive change as a result of the pandemic. If they did respond that they experienced some positive change, we asked them to further specify what that was. And in figure 4, we represented this in a word cloud. So, the larger words are the more common answers. So a lot of them responded that a positive change was spending more time with family. We saw a lot of responses about being reflective about their life, being more grateful about the things that they have in their life. Some also did report a change in job that they thought was positive for them. And for figure 5, we looked at therapy frequency in the sample, and we compared therapy frequency from 3 months prior to the pandemic to during the pandemic. And we saw that about 38% of our sample reported going to therapy prior to the pandemic, which declined to about 28% during the pandemic. And lastly, in figure 6, self-reported feelings of worry, sadness, anxiety, loneliness, and negative thoughts all significantly increased in our sample from prior to the pandemic to during the pandemic.